It contains ranitidine, 150 mg. Introduction. Aslock 150 tablet is a medicine that reduces the amount of excess acid made by your stomach. It is used to treat and prevent heartburn, indigestion and other symptoms caused by too much acid in the stomach. It is also used to treat and prevent stomach ulcers, reflux disease, and some other rare conditions. Aslock 150 tablet is also commonly prescribed to prevent stomach ulcers and heartburn caused by the use of painkillers. It can be taken with or without food. How much you need, and how often you take it will depend on what you are being treated for. Follow the advice of your doctor while taking this medicine. This medicine should relieve indigestion and heartburn within a few hours. You may only need to take it for a short time when you have symptoms. If you are taking it to prevent ulcers and other conditions, you may need to take it for longer. You should keep taking it regularly to prevent problems from happening in the future. You may be able to help improve your symptoms by eating smaller meals more often and avoiding spicy or fatty foods. Most people do not experience any side effects while taking this medicine. However, the most common side effects include headache, constipation, feeling drowsy or tired, and diarrhea. These side effects are usually mild and will go away when you stop taking this medicine or as you adjust to it. Consult your doctor if any of these side effects bother you or do not go away. Before taking it, inform your doctor if you have any kidney or liver problems. Also tell your doctor what other medicines you are taking, as some may affect, or be affected by, this medicine. This medicine is usually considered safe to take during pregnancy and breastfeeding if it has been prescribed by a doctor. Avoid drinking alcohol, as this can increase the amount of acid in your stomach and make your symptoms worse. Uses of Aslock 150 tablet. Heartburn, gastroesophageal reflux disease, acid reflux, peptic ulcer disease. Benefits of Aslock 150 tablet. In heartburn. Heartburn is a burning feeling in your chest caused by stomach acids traveling back up towards your throat and mouth, acid reflux. It happens because a muscle above your stomach relaxes too much and allows stomach contents and acid to come back up into your esophagus and mouth. This can be a symptom of indigestion, dyspepsia. Aslock 150 tablet belongs to a group of medicines called histamine 2 antagonists. It works by reducing the amount of acid your stomach makes and relieves the pain associated with heartburn and indigestion. You should take it exactly as it is prescribed or as it says on the label for it to be effective. Some simple lifestyle changes can help stop or reduce heartburn. Think about what foods trigger heartburn and try to avoid them. Eat smaller, more frequent meals. Try to lose weight if you are overweight and try to find ways to relax. Do not eat within 3 to 4 hours of going to bed. In gastroesophageal reflux disease, acid reflux. Gastroesophageal reflux disease, GERD, is a chronic condition. It happens because a muscle above your stomach relaxes too much and allows stomach contents to come back up into your esophagus and mouth. Aslock 150 tablet belongs to a group of medicines called H2 receptor antagonists. It reduces the amount of acid your stomach makes and relieves the pain associated with heartburn and acid reflux. You should take it exactly as it is prescribed for it to be effective. Some simple lifestyle changes can help stop or reduce heartburn. Think about what foods trigger heartburn and try to avoid them. Eat smaller, more frequent meals. Try to lose weight if you are overweight and try to find ways to relax. Do not eat within 3 to 4 hours of going to bed. In peptic ulcer disease. Stomach ulcers are usually caused by using nonsteroidal anti-inflammatory drugs, NSAIDs, or by bacteria called Helicobacter pylori. They both break down the stomach's defense against the acid it produces to digest food. This damaged the stomach and allows an ulcer to form. Aslock 150 tablet may be used to treat these ulcers. It reduces the amount of acid your stomach makes, which prevents further damage to the ulcer as it heals naturally. You may be given other medicines depending on what caused the ulcer. You need to keep taking the medicine as it is prescribed for it to be effective, even if the symptoms seem to disappear. It may also be prescribed to prevent stomach ulcers from forming by reducing the amount of acid. Show more. Side effects of ASLOC 150 tablet. Most side effects do not require any medical attention and disappear as your body adjusts to the medicine. Consult your doctor if they persist or if you're worried about them. Common side effects of ASLOC 150 tablet. Sleepiness, headache, tiredness, constipation, diarrhea. How to use ASLOC 150 tablet. Take this medicine in the dose and duration as advised by your doctor. Swallow it as a whole. Do not chew, crush or break it. ASLOC 150 tablet may be taken with or without food, but it is better to take it at a fixed time. How ASLOC 150 tablet works. ASLOC 150 tablet is a histamine H2 receptor antagonist. It works by reducing the acid produced in the stomach. This helps to relieve acid-related indigestion and heartburn. Safety advice of ASLOC 150 tablet. Alcohol. Unsafe. It is unsafe to consume alcohol with ASLOC 150 tablet. Pregnancy. Safe if prescribed. ASLOC 150 tablet is generally considered safe to use during pregnancy. Animal studies have shown low or no adverse effects to the developing baby, however, there are limited human studies. Breastfeeding. Safe if prescribed. ASLOC 150 tablet is probably safe to use during breastfeeding. Limited human data suggests that the drug does not represent any significant risk to the baby. Driving. Safe. ASLOC 150 tablet does not usually affect your ability to drive. Kidney. Caution. ASLOC 150 tablet should be used with caution in patients with kidney disease. Dose adjustment of ASLOC 150 tablet may be needed. Please consult your doctor. Liver. Caution. ASLOC 150 tablet should be used with caution in patients with liver disease. Dose adjustment of ASLOC 150 tablet may be needed. Please consult your doctor. What if you forget to take ASLOC 150 tablet? If you miss a dose of ASLOC 150 tablet, take it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and go back to your regular schedule. Do not double the dose.